Welcome everyone. This video will cover the fundamental topic of the 8 rights of medication administration. I know this information is very basic, but it is pertinent to your NCLEX exam. You will certainly have questions with these topics embedded in them. So let's get started. The first right is the right patient. This means that first and foremost, you must verify your patient's name using 2 identifiers. This could be their name and medical record number. That's the most common combination. You also need to check their name on the order for the medication and their identification band, usually on their wrist. That band has to be attached directly to them, not sitting on the keyboard or attached to the bed, but attached directly to the patient. You also need the patient to identify themselves by stating their name and birthday if they're able to. Obviously, if somebody is in a coma, they are not conscious, or maybe not in their right state of mind, this wouldn't be appropriate. But for most patients, have them state their name and birthday, check their band attached to their wrist, and verify their MRN. Okay, our second right is the right medication. You will need to verify the name of the medication, check the medication label, and check the order. Be very cautious of any look-alike, sound-alike medications, as with those long generic names, it can be quite easy to confuse two medications that look similar. So just remember, for the right medication, to verify the name, check the label of the medication, and of course compare all of that to the order. Our third right is the right dose. You need to verify the dosage written in the order, and then you need to make sure that that dosage is actually appropriate for your patient. So find a current drug reference, find the safe dosage range. Remember, this can be different with age. Geriatric patients don't clear drugs quite as quickly, so they may need a smaller dosage. And same thing with pediatrics. We always verify a pediatric patient's dosing weight in kilograms to make sure that the medication they are receiving is within a safe dosage range. Remember also that patients with renal insufficiency may need lower doses because their kidneys are not as effective in clearing the drug from their system. So you need to calculate this dose, check that it is correct, and have another nurse calculate the dose independently to double check you are both getting the same answer. This means that the dose is appropriate per a current drug reference and that the milligrams are correct for the number of milliliters you're administrating or whatever the case may be. So that is right dose. Fourth, we have our right route. You need to check the order for the route that is ordered, how the doctor wants you to give this medication. Then you need to ask yourself, is it safe to give the medication this way? And can the medication be given this way to this patient? For example, do you have a patient who's at major risk for aspiration, but the provider has ordered a lot of PO medications per mouth? Or are they ordering IV medications and you don't have IV access? Those are two routes that would not work in that situation. Also, remember that dosage can depend on the route, so your previous right, the right dose, will depend on this right, the right route. Next, we have right time. You need to confirm that you are administering the medication at the time it is ordered. But you also need to verify the frequency with which you're giving that medication. For example, do they have IV Tylenol ordered every 4 hours? Just because you're giving that dose at noon when it is ordered, it may be too frequent. For our example here with acetaminophen or Tylenol, if you're giving that dose of Tylenol 1,000 milligrams at noon and it's ordered at noon, Q4, well, yes, it's ordered at noon, you're giving it at the right time, but if you're going to continue giving that Q4 after a whole day, they would get 6,000 milligrams of acetaminophen, far more than the maximum recommended dose of 4 grams or 4,000 milligrams. So verifying the frequency is just as important to making sure that the dose is being given at the ordered time. You also want to double check what time the last dose of the medication was given, because if it was given late, you might need to adjust the time you're giving this medication to make sure the frequency remains safe and that you're not giving it too close together. All right, sixth, we have our right documentation. I know you've heard this before. If it wasn't documented, it wasn't done. This means for medication administration, if you don't chart in your MAR that you give that, the team will think the patient did not get that medication and they might change dosage or something depending on your actions. So you need to document these following components: the time you give the med, the route it is administered, and any pertinent vital signs. So for route, if you used an IV, document the access. If you gave them an injection, what site did you use? For vital signs, this is common sense. Anything that you're looking to change and give a certain response to the patient, a before and after needs documented. So for this example, antihypertensives, we need to document a blood pressure. Also, a side note, you should never ever pre-chart medication administration. You never know what's going to happen. That patient could throw up the medication. The IV that you're supposed to be giving it in maybe went bad and it's not working. Maybe the patient or the family refuses. You simply don't know until that medication is successfully administered what is going to happen. So don't ever pre-chart. Next up, we have the right reason. I think this is pretty self-explanatory, but before administering any medication, you need to always ask yourself why the patient needs this medication. Look through their history, what conditions they have, and what the indications for this medication are. Also, is this an older patient or a patient with a chronic condition that has many, many medications? Are all of these medications still indicated? Do some of them have potential side effects when given together, or synergistic effects where the dosages may need to be altered? You, as the nurse, are the primary patient advocate, so take the time to think through these situations and raise questions to the providers if it seems like something is out of whack or there's not a good indication for giving this medication. Last but not least, we have right response. So you have verified your patient, the medication, the dose, the route, the time, the documentation. You gave the drug for the right reason. Now you need to monitor the patient to verify that they have the response you are expecting. So did that antihypertensive lower the blood pressure? Did your potassium supplement increase their potassium level? Whatever vital sign or lab value you're trying to affect, you need to watch it and document all of your monitoring. Follow up those lab values, take your vital signs and document them. Show that your medication has had the right response, and if it hasn't, contact your healthcare provider. All right, let's wrap things up with one NCLEX question. Which of the following fall under the right dose for the 8 rights of medication administration? Select all that apply. A. Using a drug reference to verify the dose ordered is appropriate. B. Identifying the patient using 2 separate identifiers. C. Having a second nurse independently calculate the medication dosage. Or D. Double checking the last time the medication was administered. The correct answer was A and C. A is correct. Using a drug reference to verify the dose ordered is appropriate is a part of the right dose check in the 8 rights of medication administration. The nurse should always verify that this dose is appropriate by checking a current drug reference for the medication and verifying what is ordered is in the safe range. And remember, this can be different for different patient populations. B was an incorrect answer because identifying the patient using 2 separate identifiers falls under the right patient part of the 8 rights of medication administration. C was correct. Having a nurse independently calculate the medication dose, a second nurse, is an important part of verifying the right dose. And D was incorrect. Double checking the last time the medication was administered is a part of the right time step. So as you can see, these are fairly straightforward. You should be able to get these questions right, no problem, as long as you review what the rights are and kind of know how to put them into practice. Let us know if you have any questions about this, though. And as always, good luck with your studying.